The first thing I want you to do is pause for a moment and take a close look at your fingernails. Don't focus on whether they are polished, neatly trimmed, or in need of care. Instead, study the surface, the shape, the color, the tiny ridges, the pale area near the base, and the skin surrounding each nail. Most adults glance at their hands every day without truly observing them. Yet your fingernails quietly preserve valuable clues about what may be happening inside your body. They can reflect changes involving your nervous system, kidneys, liver, circulation, and overall metabolism long before noticeable symptoms appear. Here at Vital Aging, we believe these subtle signals deserve your attention because they often reveal concerns that develop gradually over months or even years. Learning to recognize these small changes may encourage earlier conversations with your healthcare provider and help you become more aware of your overall health before problems become more advanced. I've spent many years studying how changes throughout the body often reveal themselves in places most people rarely think to examine. One of the most overlooked areas is the fingernails. They are far more than a cosmetic feature. They provide valuable insight into how your body is functioning beneath the surface. Every day, your nails record subtle changes influenced by circulation, nutrition, nerve health, and metabolism. As we grow older, especially after the age of 60, the body's ability to compensate for silent health problems gradually becomes less effective. The reserve capacity that once allowed organs and tissues to recover quickly naturally declines over time. This does not mean aging itself is a disease, but it does mean the warning signs of developing conditions become increasingly important to recognize. In this video, Vital Aging will guide you through 4 distinct nail changes that medical research has connected with serious health conditions affecting the nervous system, kidneys, brain, and overall metabolism. These are not unusual or extremely rare disorders. They are conditions that become more common with age and often progress quietly before obvious symptoms appear. Many people wonder why their healthcare provider has never mentioned these signs. The answer is usually simple. Routine appointments are often limited in time, making it difficult to discuss every possible early indicator of disease. That makes it even more valuable to understand what your own body may already be trying to communicate. Be sure to stay until the end because the 4th nail sign is one of the most commonly overlooked. It frequently appears in individuals who have experienced unexplained fatigue, mild memory difficulties, tingling sensations, or other subtle neurological symptoms for years without realizing their nails may have been offering an important clue all along. Before we begin exploring these important nail changes, now let us move to the 2nd nail sign, which often appears suddenly enough for people to notice, but is frequently misunderstood. Carefully examine your fingernails for horizontal grooves or deep lines that stretch from one side of the nail to the other. Unlike vertical ridges, these lines run across the width of the nail and often feel like a shallow dent when you slide your finger over them. These grooves, known as Beau's lines, develop when nail growth temporarily slows or stops because the body experiences significant physical stress. A serious infection, major surgery, high fever, or another severe illness can interrupt the nail matrix, leaving behind a visible groove that gradually moves toward the tip as the nail continues growing. However, recurring horizontal grooves deserve closer attention, especially in adults over 60. If new Beau's lines continue appearing without any obvious illness to explain them, they may reflect an ongoing internal problem rather than a single event. One condition that has been linked to this pattern is chronic kidney disease. Your kidneys work around the clock to remove waste products, balance fluids, regulate important minerals, and support healthy blood pressure. When kidney function slowly declines, waste products begin accumulating in the bloodstream. Even before noticeable symptoms develop, these changes can place stress on rapidly growing tissues like the nail matrix, causing repeated interruptions in nail growth. Another nail change, sometimes seen alongside Beau's lines, is called half and half nails. In this pattern, the lower portion of the nail appears pale or white, while the upper section, closer to the tip, looks darker, pink or brownish. If you notice recurring grooves, unusual color changes, or both together, speak with your healthcare provider about having your kidney function evaluated through appropriate blood testing and medical assessment.
Imagine noticing shallow grooves across your nails every few months without remembering any serious illness that could have caused them. Many people assume these changes are simply another part of aging, but repeating patterns deserve closer attention. Chronic kidney disease often develops gradually, producing very few noticeable symptoms until significant damage has already occurred. Because of this, your fingernails may provide one of the earliest visible reminders that something inside your body needs further evaluation. Pay attention not only to the grooves themselves, but also to other symptoms that may seem unrelated. Swelling around the ankles, muscle cramps, persistent fatigue, changes in urination, dry or itchy skin, difficulty concentrating, or a constant feeling of low energy can all accompany declining kidney function. Individually, these symptoms may appear harmless, but together they create a picture that should not be ignored. At Vital Aging, we encourage using these observations as conversation starters